to be as safe as possible. So this, you see that? I just inflated just put the cover on it. And I'm gonna have him suction using that to practice. So basically, that is an inflated cuff right there.
Where's the cuff?
This is the cuff,
Okay,
trach cuff.
I see.
It's a balloon, basically. So the purpose of this balloon is to maintain a good seal from the ventilator volume to his lungs so air doesn't leak out. So basically, it's keeping also secretions that go inside the airway in the not in the esophagus, but the trachea, and it protects something that he could be aspirating, and it protects it from going into his lungs.
Okay.
Yeah, so this balloon is important. And you don't want to overfill it. You want to keep it at like this pressure, kind of a medium pressure. So in the hospital, they have these pressure manometers, but at home, you'll be doing more like a minimal leak. So if you hear a sound, like an air escaping or squeaking sound from here, from the trachea, you need to add like 1 cc of air. This is a 30 ml syringe. You'll be getting like a 10 ml syringe, so it's easier. So what you'll do is like, if you felt this and it was flat and you hear air escaping, let me just show you what, like that would be a little bit on the low side. Air might escape. Every time he gets a breath in, it might escape and you could hear it audibly. Then you would just take a syringe like this with a lure lock. This is the one-way valve. It's a white valve there with a spring. And you're gonna add 1 cc of air until the squeaking stops. Push and then add 1 and wait.
So you just keep adding 1 cc increments until, okay.
And listen, let him ventilate a couple times. And if you still hear air, you're gonna put another cc in, push, and then add 1 cc. There's 1 right there.
You want me to give it to him?
See, and then just for an example, I'll show you a larger amount when I fill it up. You just watch the balloon. You see that? So this is overinflated. That's too. You know what? How much pressure that is causing in an airway, in his trachea. It's going to cause erosion. So we never. And look, it's even going to push this. It's even going to push the syringe back. Look at that. See, it pushed it back because it's too much pressure.
What is erosion?
When pressure causes by this overinflated syringe causes the rings to get eroded. It's cartilage. Your trachea is a cartilage.
The cartilage erosion.
It gets softer, and so you have to add more air. It has the ability to expand, but what you're doing is you're causing erosion of it, and then you're needing more air and more air and more air. Eventually, you'll have to change to a larger tube to go further down where the damage is. So that's called tracheomalacia.
Don't overinflate.
Correct. Just inflate to the minimal leak. To where you have the minimal leak is basically when you hear air escaping, and sometimes you would do this with a therapist use their stethoscopes and they put it right here at the trachea, below the trachea, and they'll hear air escaping and they'll just add air 1 at a time. Still hear the leak 1 at a time, and then 1 more. Okay, the leak is gone, and then that's called minimal leak. Okay, so that's the point where you close the leakage with just 1 extra cc of air. And this should always feel soft, medium soft, never hard or firm. And this does get hard, or after with time.
Yeah.
So whatever this feels like, that's what it's gonna feel like inside the trachea.
Oh, this is a duplicate of that.
Yeah.
Oh, okay. And this is always connected.
This is always it's part of a trach tube.
Okay.
Cuff trach. This is called a cuff trach tube.
Okay.
Okay. All right. So I'll get back to this once he has a trach in, but I'm just giving you ahead of time, just letting you know that it does require air, probably after a couple weeks, maybe after a month or so. You might have to add like 1 to 2 cc's of air, maybe every other day or once a week, because and sometimes you'll even see moisture in here. You'll like, how does water get in here? Because I see water vapor in here. So what happens is his body temperature and the body temperature of the air could be, there could be a big difference. His body temperature is a lot less cooler than the air temperature or vice versa. And that causes the condensation effect. So sometimes we get, when we change trachs and when we pull the air out, we'll get water along with it. You see how I deflated that? Okay. So let me tell you the 2 parts of the trach. This is called the outer cannula or OD. If you look here,
Wait, you said OD?
OC,
OC, okay.
outer cannula. Actually, OD is correct. It's outer diameter. Outer diameter. OD. And then ID, inner diameter. So on this 6, it's 10.3 millimeters outer diameter, and inner diameter is 6.4. I need to see if I have an
So it's
8.
an OC with an OD of 6.
And you live in OC. So this one's a little bit longer and a little bit larger, 12.2 outer diameter.
Okay.
This is probably what he'll get is the 8.
Okay.
Okay, and they don't make these anymore, so that's why I'm fine with trashing these or using this as an example. They stopped making this like 3 months ago. Production of these has stopped. So he's gonna get an 8. If it's gonna be a Covidian, it'll be a CN85H. That'll be the reference number. Okay, so
Did you get all that, Garrett, in your notes?
I don't really know what we're talking about right now.
we're talking about a trach tube.
So that's the part that's.
The
filling
cannula.
it in,
The
so-
whole, so the whole,
The
this
whole
is the
thing.
whole thing. It's called, this is a trach tube with the inner cannula.
It's a cuff trach.
So, and it's cuffed. So that's what he's gonna get, a cuffed trach tube. We don't know what size yet or what brand. There's only 2 major brands. It's gonna be Covidian, Shiley, or Portex. Those are the only 2 brands that we're currently using out. So his is gonna be cuffed. You don't want a cuffless because he needs a patent airway. It needs to be a closed system. This is the inner cannula.
Okay.
Okay, so this has to be changed every day.
Every day. Okay.
Yeah, so it goes right inside like that. The way you change it is like you'll disconnect him from the ventilator, and you'll have a cannula already right here, a clean one. Then you'll have an area for the dirty one that you're gonna throw. So you just basically disconnect them, and you're gonna pull the inner cannula out, and then put it in the trash. Get the new inner cannula, and when you're putting inner cannulas in, the best way to put inner cannulas is going at if I'm using my right hand, this is a 9 o'clock. This is 6 o'clock.
Okay.
That's 3 o'clock. Okay, so I usually go 9 o'clock, and once I'm in, I just slowly push it to 6 o'clock, and it'll go right in, and then just push to lock in place. And then just add him back to the vent circuit with the Omniflex. And sometimes you have to make sure that you push this in a little, as far as it can go, with a little twist. And that way it doesn't fall out too easily. Okay. So sometimes when you're turning him, you got to make sure you have enough, slack. If he's going away from the ventilator, you give him enough slack so that it's not going to pull.
Rip it out.
And then when you turn him towards you, always look at his face and look at where the circuit is and where his trach is at, so it's not pushing into him. Okay. So those are the things that you have to know once he has a trach, is that this is connected to his neck, right? The only thing that's keeping it in place is actually this cuff here and the trach tie. Okay. So if his balloon is filled, which I'm gonna refill it again.
So the only thing that's keeping the outer cannula in place is the cuff and
The trach, just say the trach tube. The trach tube is the balloon, the cuff.
holding it in place.
Yeah, and that's actually, it's gonna be hard to okay, so your stoma is gonna be about that size, because it'll be the size of this stem, and this is like twice the size. So it's got to go through that small opening, and it's gonna be tough to come out. Plus you have this
Keep it in.
keeping it in place. But I've seen people this are not watching the trach, and they'll
And it rips
pull,
off.
and then all of a sudden it's coming out, pulling out like this, and it's hurting the man. It'll be hurting. Sometimes it'll come all the way out, and they're bleeding, and now they can't breathe, and they're like, what do we do? What do you do? Call 911. So that's what you have an AMBU bag for, a manual AMBU ventilation, which we don't have right now, but we'll talk about it once he gets to the trach. Well, so that would be like a 911 situation there. If he gets what we call that an inadvertent decannulation.
We're hoping that's not gonna happen.
Yeah, never let an inadvertent decannulation happen on your watch. That's one of the worst things that could happen to anybody. So, it's very hard to do. It takes quite a lot to decannulate a man with a cuffed trach. So it takes a lot of pressure, okay? So this is the outer cannula, and this is the inner cannula. And this inner cannula, we got to make sure that he gets proper humidification, because his secretions, his mucus in the airway, if they don't have enough humidity, it will dry up and it will harden and it'll block this right there. We call it a mucus plug. If there's a mucus plug there, even if it's partially obstructed, he's going to have a hard time breathing. So that's why we keep our patients well humidified when they have trach. You should be able to see condensation here and here.
So what do you mean by well humidified? How do we do that? Is it
He's gonna. You see, he has a heated humidifier.
it's not heated actually.
Well, he doesn't have. It's in the room. So he uses dry air during the day, but he uses the humidifier at night, right?
Oh, you mean the one connected to the vents, the
Yeah.
BiPAP? Okay, yeah.
Yeah, the one is right here.
Yeah, there's one there as well, I think.
Yeah.
So what's the bag for that kind of a inadvertent decannulation called? You said there would be some kind of a bag.
Ambu
Bag.
manual ventilation. It's a ambu bag or manual ventilation bag with mask.
Whatever's in that room is not being used at night, as far as I know.
Oh no, it's not. It's
It's
the
not being used.
humidifier.
Just these two humidifiers here.
Yeah, he's gonna have a humidifier for sure. He doesn't need this anymore. He will not need this.
Okay, well not. Huh?
Yeah, I mean, you can just do it for the room,
Okay.
but he's already gonna have his own humidifier when he's trached. And you're gonna utilize that humidifier that's in the room. And if he goes outside of his room where there's no extra humidifier, I can provide him a second humidifier for this bedroom here, or this room here, or he can use a HME, a heat moisture exchange filter. HME, heat moisture exchanger. And heat moisture exchanger is placed about right here, close to the exhalation valve. And it actually traps exhaled air, which is gonna be warmer air, and it's gonna eventually be filled with moisture. So it basically he's inhaling his own rebreather of air and moisture from his lungs, and that becomes his humidifier. It's called a heat moisture exchanger, HME.
Is that better than the actual humidifier, or is that different?
It's just different.
So that's
It's-
for when he's
Is it
going
one
out,
or the
right?
other, or is it?
You could,
That's what
it's
he's
one or
gotta
the
have.
other.
He's gotta have that if he goes
If
somewhere.
it goes somewhere.
Yeah, if he's,
Oh,
yeah,
that's what it's for.
HME is used for portability when he's outside of the bedroom and not on his heated humidifier.
Right, right.
Gotcha.
Okay, so like if he has a doctor's appointment and he's gonna be gone for 2 to 4 hours, you want an HME.
Okay.
And the Bacti filter, this filter here is very important too. He uses it all the time.
Filter.
But this filter here, this filter, this one and the other one for the vent, they can trap up to 5 micron size of bacteria, viruses, or any cat hair, dust, anything, pollen.
Dog here.
Yeah, dog hair. All right. All right. So we're gonna do a test right here, and whoever didn't have a chance, you're gonna do this for me, okay?
Okay.
So I'm gonna pull this out. Just go ahead and pull the whole thing out and just. Oh, it's trapped.